Let's talk about breast cancer. A woman goes to you, breast cancer runs in her family. What can she do?
Well, there are a lot of things she can do. The problem is, though, that there are a lot of things she can do. What I mean by that is that you can't pick up a magazine article, a newspaper nowadays that doesn't tell you 30 things you can do to lower your risk of breast cancer. And most people can do quite a few things for a while, but not for their entire life. So when it comes to creating a lifelong strategy for staying well, what really becomes important is what are the most important things that person needs to do. And that's where we get into individualized testing. Now, that is a variety of things, from how do they metabolize estrogen, which will help us determine a personalized nutrition supplement program so they can process their hormones as safely as possible. It may involve looking at their actual DNA blueprint to see whether or not they have some genetic susceptibility or special needs when it comes to, say, B vitamins. So it's a personalized solution, and what you're looking at doing is trying to find the most important things for that person to do to minimize their risk.
By what? Building their immune system?
Well, by making their immune system responsible, not overreactive, not underreactive. So if someone comes to me with a concern about breast cancer, which, you know, is probably on the mind of most women since it's frighteningly common in our society, there are things that we can do to minimize their risk. There are things that they can do to be proactive and lower that risk.
What about mammograms? Do you believe in those?
I do believe in mammograms. I do believe in annual mammograms for women, generally speaking, once they reach the age of 40. New mammograms are basically very low radiation, which is often a concern for a lot of women. But a mammogram is also only as good as the mammographer reading them, so I'm very picky about where I like to send my patients for mammograms. I'm not a big fan.
So make sure that this is all they do, is read mammograms.
That's right. Don't go to a mobile unit where perhaps the radiologist doesn't do that every day of the week. Early detection is part of the equation, but prevention is actually the far more important part of the equation, because how we look after ourselves our entire life is what gives us our cumulative risk for breast cancer. So it's everything from whether or not you took the birth control pill and for how many years as a young woman, to whether or not you balance your B vitamins while you lived through a stressful marriage. There are just an enormous number of things that come into play.
So you have a program then for breast health?
We do. But it's, again, individualized to fit each person's unique needs, because there is no one size fits all.